there are two primary causes of SVT in children. There's the type that you grow into and the type that you're born with. We talk to the patient about symptoms. Most children feel their heart racing. That's sort of the universal symptom. They may complain of chest pain, lightheadedness, shortness of breath, nausea, or pallor. In teenagers, though, 20% of teenagers pass out, and about 50% of teenagers have lightheadedness. So very often those symptoms may be mistaken for other problems that are not necessarily heart-related. And it's not until you actually make the diagnosis that you can say, oh, this is why you were getting lightheaded. It's not because of the common faint that teenagers have, but it's actually because your heart was racing. SVT is not a life-threatening problem. It's a pain in the neck problem. So there's three different approaches that we can take to the treatment of it. One is to watch it, or what we call expectant management. And that's a reasonable approach in children who have rare symptoms. If they have more frequent symptoms or more severe symptoms, then the options are medications versus a procedure called catheter ablation. The third option is a heart catheterization procedure called an electrophysiology study and radiofrequency or catheter ablation. And in most children over 5 with SVT who have significant symptoms, that's usually the treatment of choice. First off is the procedure, is to learn what is my child going to go through to have this done. What can I expect? What are they going to feel? How do you do it? What are the complications? And how are things going to go afterward? And knowing that catheter ablation offers a likelihood of cure. About 90 to 95% permanent cure rate with a very, very low risk procedure. So most of the time afterward, the patients are glad that they had it done.